Hi, I'm Dr. Tom Kravis, Physician Executive for 3M Consulting Services. Thank you for joining me. Today we're going to talk about ICD-10 documentation for nephrology and urology. There are some changes you will need to make in your documentation to support ICD-10, but there are instances of documentation that can remain the same. We'll help you filter out the essentials. So let's get started. I know you are busy in your clinical practice, so I will briefly summarize the key takeaways. In your documentation of patient care, consider the use of adjectives. Link the cause and effect of each condition. Be specific about aspects of a disease and each anatomical site, and use exact dates when appropriate. A little more on each of these. Differentiate in your notes whether or not a condition is acute, chronic, or acute on chronic whenever appropriate. For example, document chronic kidney disease stage 3 instead of simply renal failure. Use due to or secondary to indicate cause and effect, and to record all conditions the patient may have, such as hydroureter due to vesicoureteral reflux. Think about the most current terminology to describe a condition or different aspects of the disease. For example, can acute renal failure be further specified as due to acute tubular necrosis? Precisely designate anatomical site, such as post-traumatic urethral stricture of the male urethra. You need to specify if the stricture has occurred in the bulbous, membranous, anterior, or meatal portion. Use exact dates when appropriate. For example, when a patient is admitted for acute myocardial infarction and the patient previously had a recent MI, document the exact date of the recent MI. Ask yourself, what else could I add in my notes about this patient's condition that would better communicate how sick the patient is, which in turn better communicates the resources needed for patient care. Incorporating these aspects into your documentation will result in an accurate picture of your patient's severity of illness and risk of mortality. This in turn will result in accurate public reporting on quality and outcomes. And it will help reduce the number of queries you receive to clarify your documentation. In the upcoming slides, we'll take a look at some diseases and procedures that have new documentation requirements under ICD-10. There's not a lot new with urinary tract infections in ICD-10. If you know the site of the infection, it's important to note it, such as cystitis, urethritis, or pyelonephritis, and if the condition is acute or chronic. If the infection is related to a device, you must document this relationship, such as UTI due to indwelling Foley catheter. Lastly, if you know the organism causing the infection, make sure to document the cause and effect relationship in your note, such as E. coli UTI. What is new with urinary tract infections is that the diagnosis of urosepsis can no longer be coded in ICD-10. In ICD-9, a diagnosis of urosepsis defaulted to the code for an unspecified urinary tract infection. If you record a diagnosis of urosepsis in the ICD-10 environment, it will generate a query asking you for clarification. If by using the term urosepsis, you mean the patient has a UTI, then document UTI. If you mean the patient has septicemia from a urinary source, make sure to document this. For example, E. coli sepsis due to UTI. There is not a lot new with regard to the documentation of acute kidney failure in ICD-10. You must specify the etiology of the acute kidney failure, if known or suspected, and whether it is acute tubular necrosis, for example, or as a result of trauma or a procedure. You should avoid using the term acute renal insufficiency when you mean acute renal failure, as insufficiency is assigned to a generic or non-specific code in ICD-10, which will not do justice in explaining your patient's severity of illness and risk of mortality. Not much has changed in ICD-10 with regard to the documentation of chronic kidney disease either. You must specify the stage of CKD, stages 1 through 5, or end-stage renal disease. Additionally, you must also indicate the etiology, such as diabetic CKD or hypertensive CKD. Try to avoid using terms such as chronic renal insufficiency and chronic renal failure interchangeably, as they are coded differently and will result in inaccurate classification of your patient's severity of illness and risk of mortality. What's new with cystitis is that it is coded as either with or without hematuria. For example, on this screen you see that code N30.01 is assigned when acute cystitis with hematuria is documented. You will also need to specify the type of cystitis, such as acute or interstitial, to name a few. Again, on the screen, for example, you see that N30.10 is assigned for chronic interstitial cystitis without hematuria. Lastly, indicate if there is any known or suspected organism causing the cystitis. What's new for glomerular disease is that ICD-10 recognizes that nephritic and nephrotic syndrome have very different clinical presentations and are therefore classified to different categories. A diagnosis of glomerular nephritis or nephritis is classified to nephritic syndrome. You don't have to document the term nephritic syndrome. However, when known, you will need to document the glomerular nephritis or nephritic syndrome as acute, chronic, or rapidly progressive. Additionally, specify the type of morphologic changes when known, such as with focal and segmental glomerular lesions or with dense deposit disease. For example, you see on the screen several codes for acute nephritic syndrome with several different morphologic changes. Nephrotic syndrome in ICD-10 includes diagnoses such as nephrosis, Ebstein's nephrosis, lipoid nephrosis, congenital nephrotic syndrome, and nephrotic syndrome. ICD-10 does not differentiate between acute or chronic. However, as in nephritic syndrome, document the type of morphologic changes when known, such as glomerular lesions or with dense deposit disease. For example, you see on the screen several codes for nephrotic syndrome with various morphologic changes. In ICD-10, pyelonephritis is classified as either acute or chronic tubulo-interstitial nephritis. You don't have to document tubulo-interstitial nephritis. Your diagnosis of pyelonephritis will be crosswalked to the new terminology. However, you must document whether it is acute or chronic, the organism causing the infection, when known or suspected, and any precipitating factors such as obstruction due to calculus. Also be sure to document any complications such as acute renal failure, abscess, or sepsis and septic shock, selecting appropriate terms that show a cause and effect relationship such as due to or secondary to. There have been some significant changes to the codes for vesicoureteral reflux in ICD-10. First, vesicoureteral reflux is now classified by the presence or absence of reflux nephropathy. It is further classified by the presence or absence of hydroureter. Lastly, it is classified by laterality, either unilateral or bilateral. So be sure to further specify these aspects of the condition when present. ICD-10 provides separate codes for male and female urethral strictures. For urethral stricture in the male, specify the anatomical site such as meatal, bulbous, membranous, or anterior. Document the etiology of the urethral stricture when known, such as post-infective, post-procedural, or post-traumatic, or other. For post-traumatic urethral stricture in the female, document if due to childbirth. If you don't know the cause, document unknown cause. ICD-10 uses the more current terminology of erectile dysfunction rather than impotence as the term that was used in ICD-9, and it has significantly expanded the ability to report the cause of male erectile dysfunction. In the case of vasculogenic cause, specify whether due to arterial insufficiency, corporovenous occlusive disease, or a combination of both. Other causes specifically identified in ICD-10 include due to other diseases such as diabetes, drug-induced, and post-surgical. When due to previous surgery, identify the type of surgery such as simple or radical prostatectomy. Documenting the cause of erectile dysfunction and its reporting through ICD-10 codes will guide treatment and ensure that a determination of insurance coverage for the condition is accurate. ICD-10 has greater specificity for anatomical site and usually requires documentation of laterality for paired organs. Be sure your documentation is as specific as possible when identifying anatomic site. Unchanged from ICD-9 is the classification of malignancies as primary or secondary, which is a particularly problematic area of documentation for coders. Often, primary or secondary is not specified, and in the case of secondary malignancies, whether the primary site is still present. A statement of history of can be ambiguous and may prompt a query. For example, appropriate documentation of a malignancy would be metastatic cancer to liver from bladder. Patient underwent excision of the bladder tumor 1 year ago, and there is no evidence of recurrence in the bladder. This documentation clearly identifies the primary and secondary site and states the primary site is no longer present, all of which are factors considered in code assignment. Malnutrition is an underdocumented condition in the elderly. However, it is also an important indicator of your patient's severity of illness and an important influence on performance metrics such as readmission rates, length of stay, and quality outcomes. If your patient has malnutrition, you should document the clinical picture, the type, such as protein calorie or protein energy malnutrition, and the stage or degree. For example, mild, moderate, or severe, or first, second, and third degree. Your notes should include clinical findings such as patient with terminal cancer, 20-pound weight loss, and cachexia, and any supporting labs such as low albumin. As physicians are increasingly held accountable for patient outcomes, a huge concern is how to classify the patient who fails to follow a recommended regimen of care and gets sicker as a result. Under ICD-9, there is only one generic code for such a patient that says non-compliance, and no additional detail as to why the patient didn't follow your instructions. But in ICD-10, there are several codes to describe why a patient is non-compliant in taking drugs prescribed by you. This new clinical terminology is drug underdosing. Underdosing identifies a situation in which your patient has taken less of a medication than prescribed by you, either unintentionally or intentionally. Document in your notes why the patient isn't taking the correct amount of their medication and the associated condition. For example, patient undergoing outpatient treatment for a urinary tract infection is admitted with pyelonephritis. After investigation, it was found that the patient did not take the antibiotic prescribed for the UTI because antibiotics upset her stomach. Patient has age-related dementia and forgot to take her Cipro as prescribed, or patient could not afford to pay for the antibiotic prescription. ICD-9 provided a single code for tobacco abuse and dependence without differentiation and without further specificity for the type of tobacco product. ICD-10 provides separate codes for these. If your intended diagnosis is dependence, dependence is what you should document rather than abuse. According to the Centers for Disease Control and Prevention, most smokers are dependent, and nicotine dependence is the most common form of dependence in the U.S. Additionally, further specificity is provided in ICD-10 for the type of tobacco product dependence, as cigarettes, chewing tobacco, or other, for example, cigars, so this should be documented as well. Your documentation should differentiate between current abuse or dependence versus a person who no longer uses tobacco. Starting in 2002, the number of former smokers has exceeded the number of current smokers. For tobacco dependence, ICD-10 provides the ability to report remission and withdrawal. Examples of nicotine withdrawal symptoms include irritability, anxiety, difficulty concentrating, and increased appetite. ICD-10 also provides the ability to show a cause and effect relationship between tobacco dependence and nicotine-induced disorders when documented. Finally, your notes for a patient's exposure to secondhand smoke can be converted to an ICD-10 code that says exactly that. In ICD-9, codes for complications did not identify when the complication occurred, the body system affected, or type of surgery performed. ICD-10 codes do. In order to code a complication, the coder must know whether the complication occurred intraoperatively or postoperatively, so include these details in your notes when it is not readily apparent. Additional elements needed for code assignment, which the coder should be able to determine from the record, are body system of organ affected and body system on which the procedure was performed. For example, patient experienced an accidental puncture of small artery during neocystostomy surgery, resulting in postoperative hemorrhage. As seen here, 2 codes will be assigned for these circumstances. ICD-10 PCS has specific definitions for excision and resection. A code for excision is used when only a portion or part of an organ or body part is taken, for example, a wedge resection of the kidney. Resection is taking all of a body part. For example, removal of the entire right kidney would constitute a resection. You don't have to use the words excision and resection according to coding definitions. The coder will apply the definitions based on your documentation of what and how much was surgically removed. It is important to precisely document anatomical site for all procedures, not just excision and resection procedures. Take, for example, transurethral resection of bladder tumor. Although the physician documented resection, the coder will assign a code for excision since only a portion of the body part is removed. Here you see the table the coder will use to construct the code for this procedure. The first 3 digits of the code come from here, indicating an excision procedure involving the urinary system. The next digit of the code captures the specific body part, in this case the bladder. The approach of via natural or artificial opening endoscopic shows that the procedure was performed via cystoscope. No device indicates a device was not left in the body, as would be the case for a urethral stent. Finally, without a statement by you of biopsy or indication the procedure was performed for diagnostic purposes, the coder will select Z, no qualifier. The resulting code generated by the coder based on your documentation is 0TBB8ZZ. ICD-10 requires more detailed descriptions in your documentation of anatomical site and aspects of a disease, condition, procedure, and circumstances of patient encounters. The information generated from ICD-10 codes will result in a more accurate picture of your patients, their severity of illness, risk of mortality, and the services rendered. This in turn will result in accurate public reporting on quality and outcomes. Should you have questions about documentation for a particular diagnosis or procedure, your hospital's clinical documentation improvement specialist should be your first stop. The coding staff in your Health Information Management Department is a valuable resource as well. Thanks for joining me, and have a great day.